Good morning, everyone. Welcome to the webinar 11. I am Fritzi Cristina Diaz, the Awards Committee Chair of Ako Para sa Bata 2020 and moderator of today's webinar. I'm a stand-in for Dr. Rizzi Lorenzana, who is our chair for this year's webinar series. The 12 Ako Para sa Bata is presented by the Child Protection Network Foundation and UNICEF. Our theme this year is Care of the Child Against Violence in Time of Disease. The 11th webinar of Ako Para sa Bata 2020 is Multidisciplinary Case Management, Mental Health, and Solutions. This is the second of a three-part series on case management of child victims of abuse, neglect, and exploitation during the COVID-19 pandemic. This is a one and a half session, and the objectives are to explain the consequences of COVID-19 on the management of cases of child abuse, neglect, and exploitation. We are also here to present the best practices and innovative solutions implemented to address the challenges in handling cases during the COVID-19 pandemic. We will present and discuss a case of a 14-year-old female patient who was allegedly sexually abused by the father. Okay? The case presentation highlights the best practices and solutions in the multidisciplinary management of child abuse in the midst of a pandemic. It also brings to the fore the mental health challenges and management issues as direct consequences of what we are having right now. Okay? I'll introduce you now to our panelists today. Okay, the first is our child protection specialist of the PGH Child Protection Unit and an active consultant of St. Luke's Medical Center, BGC Taguig, and a medical specialist at the Rizal Medical Center. To give us a medical perspective, let us welcome Dr. Marisa A. Resulta. Okay. Hello, Dr. Marisa. Okay.
Good morning.
Yes.
Good morning.
Good morning, Doc. Okay, I'm so happy that you are here today. Then, of course, let's move on to the next. For the social welfare perspective, we are esteemed to welcome her. She is a social welfare officer 3 of the CSWDO of Valenzuela City and the center head of Valenzuela City Child Protection Center. Hello sa mga taga Valenzuela dyan. To give us the social work perspective, let us welcome Ms. Maria Ramos, RSW, MPA.
Morning, Fritz. Good morning, everyone.
Good morning. Thanks for sabihin ko sa Ana. Hello po. Okay. Now, okay. From Cebu, okay, this is for the mental health perspective. He is a psychologist at the Women and Children Protection Center, Vicente Soto Memorial Medical Center. He is also a faculty member of the College of Arts and Sciences at the University of Southern Philippines Foundation. To present mental health perspective, ladies and gentlemen, may I introduce to you Ms. Rosemary C. Honato, M.A. Arsay.
Hello, good morning to everyone.
Good morning. Paano ba yung pag sa Cebuano? Tama ba ako? Sa Cebuano ba ito? Paano po pag good morning?
Mayong buntag.
Ayun, okay. Mabubutcher ko, pero thank you, ma'am, for being here, no? And then last but not the least, we have a lawyer panelist. She is a lawyer at PGH Protection Unit and at the Inter-Country Placement Committee of the Inter-Country Adoption Board. She is also a professor of law at the Lyceum University College of Law and the Universidad de Manila College of Law. To provide the legal perspective for this morning, let us welcome Attorney Iris Sylvia L. Bonifacio.
Good morning, everybody. I hope you'll not get bored later.
Oh, di yan, no. I like the pros. Pero I can't do, no. I have this. Okay? And I have also a co-moderator. So please, Miss Anna, say hi. Who will handle the open forum later. May I present a therapist of PGH Child Protection Unit and a facilitator of the Masayang Pamilya para sa Batang Pilipino program, if you're familiar with that. Let us all welcome Miss Annalyn C. Lindo.
Good morning, Ma'am Fritz. Good morning, everyone.
Okay, thank you for the help. No?
Thank you.
So she will man the Q&A later. Okay? So, yes, you'll hear more from me. I'm sorry, I have to read the background, okay? So, this is a case that has been, well, it is a case that is very generic. This is the usual, okay? The case involves a 17-year-old, well, 14-year-old, now in this case, is it 14-year-old now? Female patient who was brought to WCPU for, well, we're just going to the generic side of this one, no? It's a 14-year-old female patient who was allegedly sexually abused by the father. She demonstrated typical signs and symptoms of severe depression with reported trauma symptoms such as loss of appetite, frequent nightmares about the alleged incident, and also sleeplessness. So this is very generic for those of you who are in the field, now whatever field you are here in, well, it's very familiar to you. No? That will be our case. Now you can screenshot so that will serve as a guideline. Okay. Let's move on to the next slide, please. Okay. Okay. So these are the issues. I will not be reading this because we are out of time, but you can screenshot this or you can go back and see. But rest assured that this will be addressed by our speakers today. Okay. So these are the issues that are usually encountered and may be familiar to you. If you have more questions or issues that you have in mind while they are presenting, then feel free to type it in the Q&A box, okay? So we'll give each panelist 15 minutes to present each perspective, but then for the mental health perspective, I think 20 minutes because that's the highlight. Next week, that's another matter, pure legal perspective. Let's start with the medical perspective first. I'll be closing this camera and I'll call on Dr. Marisa Resulta. Okay, so Dr. Resulta.
Okay, good morning once again, and thank you for attending today's webinar. So we are presented with a 14-year-old female who was sexually abused by the father. With the new normal now in WCPU is we encounter patients during the MECQ, and we have seen an increased number of sexually abused cases. So for the new normal, we will discuss the issues that we see in WCPU right now. And first, of course, we still do the informed consent. You ask for the consent of the guardian and also that of who is the person being accompanied by the child. And aside from that, we do the face-to-face interview of the child. When we do face-to-face, right now, we wear the personal protective equipment and of course the mask, which is, we are accompanied of course by the nurse and also by the social worker. And we make sure of course that the guardian or the parent is not within the confines of the interview room. As we conduct the interview, we need of course to be sensitive to the mental issues of the child. If we see that the child is of course depressed, you have to check the affect, the behavior of the child. Of course, we will stop with the conduction of the interview. Right away, we have to refer the patient to a psychiatrist or the psychologist. And then we can, it depends on the psychologist if we can continue with the interview of the child. So when she comes to the interview, of course, you have to check, of course, if the child can be able to narrate the incident, because we don't want the child to be traumatized once again because of the incident that had happened to him or her. So of course, we have to go back also to the, as we conduct the interview, we also give them a survey, a questionnaire, what we call a PITAC questionnaire, wherein we check the psychological capacity if there's trauma on the patient. With this, we have to check, of course, kung dun sa incident na yon is naiisip ba ng bata yung nangyari sa kanya. So there is a series of questions wherein you have to ask the child via this questionnaire kung if there's an issue in terms of harm to self and harm to others. So if we see there's trauma, of course, we have to, the patient has to be seen by a psychiatrist or psychologist and do conduct an interview and also give a proper intervention on the child. And so, of course, we need also to check if this is a case of inquest. When you say inquest, the incident had happened within 72 hours of the incident. If this is a case of non-acute, of course, it is beyond 72 hours. So if it is a case of inquest, we conduct medical examinations such as pregnancy test. We also do STI screening to check for other sexually transmitted infections and give proper treatment on the child. Aside from that, also, we need to do risk assessment in terms of safety of the child. And being a pediatrician, we also have to see also if the child has had a catch-up immunization. So if the child has been given immunizations in terms of the age of the child, and also give the needed vaccinations of the child. And since this is an adolescent, we need to do the heads, which is you have to check the household of the child in terms of the safety, sino yung mga kasama niya sa bahay. We need to do also check, since etong mga bata right now is doing online studying. So we have to check also how they are doing in terms of performance in their school, in attendance in the online schooling, and also do assess also in terms of the sexuality of the child, if he or she has a boyfriend or a girlfriend, in terms of the spirituality, how she is doing in terms of connection with God and also with her parents and family members inside the household. And aside from that, we have also to check the activities that she is doing while at home. So those are just the few of the things that we have to discuss. And of course, we have to do debriefing in terms of explaining to the parents or the guardians the findings in the medical legal examination, and also giving advice to this child in terms of being an adolescent. Okay, thank you.
That is, so thank you very much, Dr. Marisa. That's short, but then we can deepen it later when if you have questions. That's from the medical perspective. Okay, so let's now discuss the social work perspective. May I call on Miss Christina Ramos? Okay.
Before I formally start, for you to better understand where I am coming from, I'd like to introduce myself. I'm Miss Christina Ramos, the center head of the Child Protection Center of Valenzuela City. So this is our Child Protection Center. It is a processing center for our children needing special protection. It is a one-stop shop with a multidisciplinary team. This is not a residential facility, so wala pong mga batang tumitira sa Child Protection Center. And the multidisciplinary team is assigned to man the Child Protection Center. So we have social workers, we have nurses, we have psychometrician, doctor, and police investigator, plus other staff, the social welfare assistant and social welfare aides. The center became operational in July 10, 2017, alongside in our commemoration to Dr. Pia Valenzuela birth anniversary. In handling or in case management, we are adhering to the protocol for case management of child victims of abuse, neglect, and exploitation. This guided us to be able to appreciate the multidisciplinary case management in putting up the local version of a child protection unit in Valenzuela City. This is the sample of what we do in the Child Protection Center for our victims of violence against children, especially in the case that Ms. Frieza discussed today. And case management is the primary role of, if you are in the local government unit, case management is the primary role of the local social welfare and development office social worker, or the LGU social worker. We shall conduct intake interviews, safety and risk assessment, home visits, collateral interviews, prepare social case study, convene case conferences, plan the comprehensive healing and reintegration program, and regularly monitor the safety and condition of the child victim. So we don't do it all alone. We should have always our multidisciplinary team to do it so that it will be a holistic intervention. Due to the devolution of social services and accessibility to the community, the LGU social worker under LSWDO is often the case manager. Yan. Sige, go on. We coordinate the provision of needed services in cooperation with partner agencies. So, in NGOs, ganun din, social worker din, ang usually case manager. Social workers' role is very crucial in the management of cases of child abuse. Our intervention is required from the beginning and for as long as may be necessary to monitor the child's safety and situation. However, all of us were challenged when we experienced COVID-19. Remember, our programs and services were designed through face-to-face meetings, even in the process of case management, which we should limit at this time. So in our case management process, despite the pandemic, we need to continue and carry on, but with a new style, protecting our clients and ourselves. At the Child Protection Center, clients and their companion would be assessed by our nurses, which we don't do before. Clients who may be suspected with symptoms of COVID, and those from barangays with high incidence of COVID-19, we attend at the tent area, the one that you see in the red box. So the tent area became an extension of our Child Protection Center. Our nurses do COVID assessment caringly. So it is very important, the tone of voice, the telling them its purpose para hindi sila kinakabahan at hindi sila natatakot. After COVID assessment, our social workers do the intake interview, whether it is at the tent area or inside our facility. We are always reminded by the trauma-informed care approach not to start the interview right away with anong pangalan mo, ilang taon ka na, saan ka nakatira, anong problema mo. Instead, rapport building goes alongside to make the child and her companion feel comfortable. Yan. So, building rapport is dapat nandun na. To make them feel comfortable and calm, like we offer water or ask them if they have already eaten breakfast or lunch. Those are simple things, but sometimes we forget about it, but very, very essential. And offer them food if they haven't eaten yet. We introduce ourselves properly as well as the center and the facilities inside it so that we would be ready or they would be ready. It is important that we guide our clients and inform them what's the next thing they could expect. In that case, they don't have unnecessary worries. In our intake, we added the contact details of the guardian and the child, like their mobile numbers. Dati wala namang masyadong ganito, no? Emails, connections, whether it is through Wi-Fi, data, or LAN apps that they are using. And this is in preparation for online and virtual hearings and other possible services we could still offer, like parenting services and teleconsultation with other discipline. Napakahalaga po nito. Even sa court, madalas no, na kami yung nauutusan na to look for the child kapag may hearing, and hinihingi nila kung may contact number, something like that. During interview, we cannot be a meter apart. We wear our PPEs, our face mask, face shield, as we all use as well as use acrylic barrier. You see the acrylic barrier on the top of the pink table. That's an acrylic barrier we use during interviews. Our clients are required of the same. We provide face masks for young children as well as the face shields. Okay. So, nagbago rin kami sa loob ng Child Protection Center. In our case today, it is important that in the intake interview, all the significant information was gathered, including family members and relatives' exact addresses, name of school, and the child and her siblings. Mind you, this would be very, very useful to all of us, especially when the case became complicated or hindi natin na makita yung bata. Okay, if the child is ready to give her statement, then the social worker would give a cue to our police investigator and doctor for a joint interview. We practice joint interview to avoid multiple interviews which add up to the child's trauma. Thereafter, physical exam will be conducted as well as the psychological screening. So please take note that we refrain from scheduling our clients for another day. We wanted to maximize the day for full assessment to lessen the possible exposure of everybody. Yung pabalik-balik, mahirap din yun para sa bata. Okay? The social worker will give a cue and call on immediate case conference to present the assessment result of each multidisciplinary team members and to prepare for providing psychological first aid. The safety of the child is of paramount consideration. In this case, the perpetrator has access to the child, which means there is a high risk that the abuse may again occur. Hence, protective custody is necessary. The LSWDO or DSWD social worker shall immediately remove the child from her home and place her under protective custody to ensure her safety. Taking the child into protective custody during normal times is already difficult, diba? Because of limited shelter who may accommodate them. At it was aggravated by the pandemic. Like in our case, we have our own shelter where we can place the child under protective custody. However, at this time, you cannot place them directly to ensure safety as well as the residents from COVID-19. Hence, we partner up with a temporary quarantine facility. It's a resort which was turned into a quarantine facility. The child shall be placed in the quarantine facility first. And then she would be tested through real-time reverse transcription polymerase chain reaction or the COVID-19 RT-PCR test. Once it resulted negative, transfer to our shelter will be facilitated. So we have our own shelter. But of course, if the child is assessed to be safe, okay. First, but of course, no, if we don't have shelters in our locality, it is really best to strengthen our partnership or network to shelters who may accommodate immediately children we are taking into protective custody. If the child was assessed to be safe, since kung may supportive relative siya, through the non-offending parent or other relative, then a contract for the child's safety will be signed, inclusive of the follow-up dates and other services. Despite that, in our initial assessment that the child is safe, risk assessment shall still follow, which means we need to validate and visit the child to assess risk of reoccurrence of abuse, especially in cases filed through regular filing or when there is no apprehended perpetrator. Why? Kasi yung perpetrator nasa labas pa. Okay? In the conduct of home visitation, we closely work with our barangay council for protection of children workers. For several years, we invested in the empowerment of our community partners for child protection. So we do orientations, trainings were provided to them. In fact, they are attending Ako Para sa Bata series, webinar series. Most of our referral comes from our BCPC workers, and our barangays of BCPC desk officers or workers, aside from the VAW workers, which is required by the law. Kung matatandaan nyo, ang BCPC, wala naman siya talagang member na those who will really directly handle sa mga ganitong cases. But dito po sa amin, nagpatalaga ng mga workers, nagtalaga ng mga children workers or help desk officers ang mga barangay po natin. In case conferences, we do it virtually or online. The child and guardian together with the BCPC worker will be in their barangay to attend the conference to limit face-to-face meetings, hence avoiding the spread of the virus. In hearings, we are also practicing virtual hearings, pati inquest for inquest yung cases. If the client cannot do online, i-assist sila ng mga BCPC workers natin. Or if they can do it online, they may be directly coordinated with. Kaya mahalaga na alam natin yung mga contact details nila at mga apps na nagagamit nila and their connections. No? In every part of case management, the child and guardian shall be aware and involved to keep them away from unnecessary burden and worries and keep their minds calm, or at least kalmado yung mga isip nila. Okay? And giving pat to everyone, the social workers and other discipline for child protection. A virtual pat to all of you. Let us say to ourselves, we are thriving, we keep on going, and carry on. Maraming salamat at magandang araw po. Ako tayo para sa bata.
Thank you very much, Ms. Ramos. Okay. So the thing is, as you can see, there's already a framework. Now we have a medical perspective a while ago, and then now we have the social work perspective. So nagkakaroon ng body. Let's now call on the mental health perspective, Ms. Rosemary Honato from Cebu. Okay po.
Good morning. I'm Rosemary Gunato from Cebu City. I'm the psychologist of the Women and Children Protection Center of the Vicente Soto Memorial Medical housed in one of the, or if the only government hospital in the province. I have been with the Pink Center since it started in 2003. We offer medical services, medical legal services, psychosocial services, including psychological services. So right now we have 5 psychologists in the Pink Center. So there are psychologists assigned to assess and intervene with children, and there are also psychologists assigned to do assessment with the adults. My training is basically on children and trauma, but right now I'm also assessing battered women. So working in the hospital, especially the government hospital in Vicente Soto, is quite a risk, especially now in the pandemic. Cebu was formerly a hotspot in COVID, and it has affected the way we deliver services to the children and the women. So as an introduction, we all know that sexual abuse of children is a global problem, but the incidence of abuse and exploitation has significantly increased during the pandemic, especially during the lockdown. Although some of the children or the victims were not able to immediately report to the police, to the barangay, or even to the center because of the ECQ or the lockdown, and there are problems with coordination with the barangay as to the transportation or even public transportation. Kay at that time, walang public transportation. The pandemic has changed the way child protection services are provided to child abuse victims. So one of the issues is um, most people would not want to go to our hospital because we are known to have a lot of COVID cases. So even if you're a victim, there would always be a stigma that if you go to the Pink Center or to Vicente Soto, you would contract the virus, which is not true actually. And that's one of the challenges that we have to face, one of the issues that we have to solve. The pandemic has limited people's movement, and as safety of the child protection professionals are important, accessing basic psychological services has been a problem, especially clients from the provinces. In the Pink Center, we do not only cater to clients from the city, but we cater to clients from other cities as well, such as Mandaue, Talisay, and even to the towns in the provinces. And they would have problems accessing basic psychological services like psychological evaluation, trauma assessment, because in our center, the process is first, the victim is seen by a doctor for medical examination, and then the social worker conducts a risk assessment to the victim and the family, and then later, or depending on the need of the client, the child will be referred to the psychologist for psychological first aid and trauma assessment. Now, those who lives in the provinces have problems accessing psychological services because of number one, the resources, and even if let's say we would recommend for telepsych, they don't have internet services or even gadgets. So mental health professionals, as in general, had to immediately create a safe and alternative way of providing mental health services. So we in the mental health field have to immediately create a way to provide services to clients who needs mental health services and interventions in a way that they can access safely. So that was the time that Telepsych was created. The pandemic and the lockdown aggravated the mental health problems that child abuse victims manifest. So if we consider this case of the 14-year-old, she has been undergoing or manifesting depressive and trauma-related symptoms. But because it is COVID, there are a lot of challenges that would exacerbate or aggravate her condition. So this we have to consider the stress from online and modular learning, being isolated from their peers because schools are closed, they cannot see their friends, and this would make them feel isolated. And because there are lockdown and at homes, they would experience violence. So these things compound the existing issues in the child. So these are the issues also that we have to consider when we do assessment. So later I will explain in the solutions how do we address this one in the treatment plan. As the mental health services has shifted to telepsychology, assessment and intervention has to be revised to fit to the need. So maraming issues with telepsychology, and it's not easy because even if, let's say, it's much easier because you can do it at the comfort of your homes, and everyone knows how to use the internet, but then doing the assessment and intervention online is quite difficult because there are issues that you have to consider. Number one issue is confidentiality. How do you maintain confidentiality in Facebook, in Messenger, because that Messenger is the platform that is most available to most people. And the access of online services and knowledge of technology are also problems that need to be explored and solved. Um, the platform that is usually used is Messenger, although we recommend using safer platforms such as Zoom, Viber, or WhatsApp. And you have to explain because most of our clients, 70% of them, really do not know the basics, although they know the basics of Facebook, of course, but uh, doing telepsychology to children and even to their parents can be quite challenging. The continuity, one of the issue also that we see is how do you continue the psychological services during the pandemic? Because before the pandemic, we do follow-ups, we do uh, therapy sessions in a schedule for the child and even to the parents, so that we can also conduct psychoeducation for parents and caregivers about the child's issues. How do you do this when it's going to be online, but you have to consider that you need to see the clients in person after your online session, and the provision of basic psychosocial services such as psychological first aid and suicide risk assessment. Now, in the height of the pandemic, all of us decided to do telepsychology, but there should be a standby psychologist in the Pink Center if no, there are clients who would need psychological first aid and suicide risk assessment. Also, there are things to consider when you do telepsych or when you do in-person psychological services, because you have to address the safety of the mental health professionals, not only the mental health professionals, but also the other staff who work in child protection or in the hospital. Um, One of the issues also that we have to deal as a mental health professional is when you are called to court in to testify in your case, and the online referral to other agencies and professionals, online or mobile case management and referral, since we have clients 2 to 3 hours away from the city, so uh, we have to do teleconsultation to them. We do we call them through phone or online for case management and referrals. The one of the ways that we solved, because we thought about um, what we are going to do during the pandemic, the services to children and women cannot stop just because there is a pandemic. But of course, you have to consider that you have to keep yourself safe. As you know, as workers in the hospitals, we are not only overwhelmed by the clients we see, but we are also overwhelmed by what is happening around us, the COVID, the pandemic, the lockdown. So it's taking a toll on us. So that's why the Women and Children Protection Center of the Vicente Soto Memorial Medical Center has created a COVID-19 case management protocol. So part of that protocol is the delivery of psychological services. So mostly we do it online, although there is a standby psychologist who will conduct trauma assessment, psychological first aid in person, but there is a limitation. Before we see 4 clients a day, but right now we are only limiting 2 clients per day that we see for trauma assessment and psychological evaluation. And we must observe safety protocols such as wearing a face mask, face shield, and physical distancing. These are a bit uncomfortable because we do not use air condition in our office, and we have to use face mask, face shield, and physical distancing, but we have to sacrifice so that we can deliver psychological services. So, basing on the case that was presented, actually the protocol for in our center is when the child comes first for medical examination, the referring agency should call for appointment, and then the child will come with the caregiver for medical examination and intake assessment by the nurse, and then the social worker will conduct uh, risk assessment later, and then they would be referred to psychological services depending on the need. Number one, if the client is highly traumatized or highly distressed at that time, so they should be seen immediately because we usually schedule clients for trauma assessment, but those who are in distress or suicidal or has suicide ideation should be seen immediately so that they could be given psychological first aid or suicide risk assessment. Now, uh, psychological testing, especially those with um, suspicion of cognitive delay, are conducted in person. It's difficult to conduct uh, psychological test online. So we have to, especially if your client has a cognitive deficit, you have to ask the client to come to the center. We have to consider also the safety of the mental health professionals who do the in-person psychological services and mental health support for them. As I've said earlier, we are already overwhelmed by the cases that we see and the incidents that has been happening around us, the COVID, the pandemic, the lockdown has, reinforced this exhaustion. So there should be safety and support for people who work in child protection. Um, Before that, uh, going back to the case of the 14-year-old, when you do, as a psychologist, when you do assessment, you always zero out on the effects of the incident that was reported, such as trauma-related symptoms or depression or anxiety. But because it's COVID and there are stress that would affect the child's functioning, so you have to include in your assessment the issues of the stress from the online learning, um, the anxiety, COVID-related anxiety, and the loneliness that children feels because of the isolation and the adjustment from the online and modular learning. So when you do your intervention, when psychologists do the intervention, they always consider these issues that would affect, the pre-existing conditions of the child. So yung treatment plan mo, yung intervention mo magiging very comprehensive, and it will take or you add the other stresses from the COVID into the whole treatment plan. One of the limitations that we see is that the clients from the provinces have no access to internet or even gadgets. They would have, like, one family would have only one smartphone, and it would be difficult because they would have no signal. And if you um, I know that sometimes you would have problems in your internet connection. So the social workers in our center coordinates with the LGU to facilitate the client's access to telepsychology. So if hindi possible na they would have telepsychology at home, they can always go to their LGU social workers or offices. So the telepsychology will be conducted there. I mean, they will be interviewed there because there is, they can access internet safely. There's a room where they can um, privately be assessed. So usually we coordinate with LGUs to facilitate clients' access to telepsychology. And another one is we are currently making a guideline for confidentiality and documentation during telepsychology because, as I've said, Facebook Messenger is the commonly used platform, but it is not safe. There is an existing one, but it is not yet written, and this should be written by, or they should be made as a guideline on how um, the confidentiality will be maintained during telepsychology. Uh, During document, kasi there is also difficulty in documenting because ideally, when you do assessment, you have your intake forms and other forms. But when you do telepsychology, sometimes you don't have the existing forms because you're working from home. So that's why you have to consider that you have to use documentation or ano ba yung mga pwede gawin mo to maintain confidentiality when you use audio recording and if you ask consent to the client during audio recordings. And there should be a separate online psychoeducation of parents and caregivers so that they will be able to understand what the children are going through and for them to be able to provide appropriate support. So aside from the telepsychology and assessment with the client, the child, the caregivers of the child should also undergo online psychoeducation. It is for them to be oriented about what the child is going through and how to handle the child if she ever manifests these things. So it's actually a support and education for the parents and caregivers. Psychotherapy and counseling sessions are conducted online or in person. So in the case of the child, um, kung saan siya, um, wherever she will be placed, it has to be assured that psychotherapy and counseling sessions are provided, whether online or in person. So one of the tasks that psychologists do, especially in child protection, is to go to court to testify. But right now, because it's COVID, most of the testimonies are done through video conference. So as a psychologist, you also have to be well versed in applications used by the court and must be aware of the limitations of the video conference testimony. So we also do weekly meetings, case management, referral, and endorsements online. But one of the things that we see as very important, not only in client management, but also in creation of the mental health services to the staff. I know that CPU is going to have a topic for this, but um, there should be sessions on caring for the caregivers, especially those who work in child protection and in the hospital, because this is a difficult time for us. So how can we serve our clients? How can we deliver psychological services if we are too stressed and too overwhelmed to perform the task? So I think that's all for my presentation. Thank you.
Okay, thank you very much. Okay, Miss Rosemary Monato. No? I am supposed to give a comment every presentation, but I'll save the comment later on. No, when everybody has presented. Anyway, this is a MDT presentation, so you see it's like a vessel wherein everybody is giving out their perspective. Now, for the legal perspective, last but not the least, may I call on Attorney Iris Bonifacio. Okay.
Hello, hello everybody. Um, I'm going to talk to you about a case of this 14-year-old. Okay. May I talk to you first about, look at this, huh? The child has been sexually abused by the father. And then, so in other words, incest ito. So now the child apparently will have to go to the barangay, of course, or better still, no? Usually kasi sa provinces, they go first to the barangay or to the police. And then from there, what does the police or the barangay do? Of course, they have to go, they have to tell her, let's go to the PAO, the Public Attorney's Office. And then when you're in the PAO, what do? The PAO will have to make you a sworn statement. And how do you have a sworn statement? Siyempre, if you don't speak English, it's going to be Tagalog or whatever dialect. And then later on, that is when they're going to be transcribing it into English. Now, okay, now you are with a PAO. What does the PAO do? The PAO interviews you, and then the PAO interviews you. You have to talk and say what happened to you. But remember, this is a 14-year-old. Does a 14-year-old voluntarily know how to go to PAO? No. So usually, that little girl is brought by who? The mother, or any relative, or probably a neighbor. In a situation such as this, if you're talking incest, in other words, the father has sex with his daughter. Usually this happens in low-income families because they live in one room and then they sleep in one room. And of course, the father has access to the child. Especially, let's say, if the child's mother is not around. Also, let us say the child is there, the father is drunk, and usually that's the case, Or sometimes the father is into drugs. Type niya to have sex. Who does he have sex with? The person who's beside him. Who is that? His 14-year-old daughter, who is very fresh, very young. Okay? So that happens, and what the child doesn't know what to do. So what happens? Probably the child will have to tell the mommy, ito pong nangyari sa akin. If the mother sometimes knows that happened already, but refuses to acknowledge that it is something wrong because she does not want her daughter to sue her husband. Why? In all likelihood, they are financially dependent on the father financially. And of course, if that's a situation when they are financially dependent completely on that man, if they sue him, they charge him with anything, with the police, they will not have money to eat. So usually tinatago yan. But in case somebody, a relative, lolo, lola, tito, tita, a very, very good neighbor will have to help the child, that person will have to take the child to the police first. Siyempre, they don't go to the PAO. They don't go to the public attorney's office right away. Hindi nila alam yan eh. As I said, these are low-income families. Sino unang tatakbuhan? Police, barangay. When they go to the barangay will say, anong nangyari sa'yo? And then, from there, tutulungan sila, dadali na ngayon yan sa PAO. If it is done within 72 hours from the time the child was sexually abused, yan ang tinatawag na inquest. Inquest kasi may mga prosecutors dyan, yung nandoon na lang sa korte, nandoon sa sa lugar nila. At any time, merong tao doon to help people who have been criminally hurt. What to me by criminally hurt? Na-abuse. Pwede namang nabanggalang or something like that. Pero itong situation natin, nasalbahe. Sinex ng tatay. So, pagpunta naman doon sa prosecutor, actually, hindi pa prosecutor, doon muna sa PAO. Yung PAO, what will the PAO do? I-interviewin ngayon yung bata. Ano nangyari sa'yo? May kasama yung bata. Siyempre yung bata, 14 years old. Anong alam ng bata? Pag nagdating doon, sasabihin nung PAO lawyer, ano nangyari sa'yo? Bakit? Sino ito? Kailan ito nangyari? Bakit? Saan nangyari ito? The PAO asks, ano ang mga nangyari? Ano ang mga sitwasyon nung nangyari, ang abuso dito sa bata? At sasabihin, nasan ngayon ang tatay mo? Siyempre, usually yung tatay nandun pa sa bahay nila. As I said, medyo walang kakayahan nito eh. So lahat sila nakatira doon. Yung bata, nagsusumbong pa lang. Hindi pa natin alam kung yung nanay ang kasama. In all likelihood, hindi kasama ang nanay. Ang kasama would probably be lolo, lola, tito, tita. Nagmamalasakit na kapitbahay, yan ang mga sumasama sa bata. Now, just in case, pumunta na siya sa PAO, ginawa na siya ng statement ng PAO, pinapirma na siya together with some mature person, some person who is of legal age, nakasama ng bata, fine. Maganda yan nangyari yun. Pero, babalik ba ngayon yung bata sa kanilang bahay? Sinumbong mo na yung tatay mo. Yung tatay mo, dyan kang kakil sa bahay mo. Yung tatay mo, nagpapakain sa lahat sa inyo. So, what do you do? If the child has to be now under protective custody, who will have protective custody over the child? sinong protective custody niyan? So, syempre, usually, ang may protective custody niyan would be yung sumama sa kanya, kung pwede, or kung hindi man ganun. Kasi usually, pagka nga sa sinasabi ko sa'yo, they're all underprivileged. Okay? So, magkakatabi ng mga bahay yan. Hindi naman pwedeng tumira siya doon sa tabing bahay lang. Yung palang distansya nun, isang pader lang, na hindi man sementong pader. So, ang gagawin, pwede ba ilagay natin sa isang protective place? Saan pwede yan? Hingi tayo ng social worker kung saan tayo. Para yung social worker naman, ang tutulong na dun sa bata. Okay? As I said here, who will have custody already of the child during the inquest and after the inquest? It cannot be the mother unless the mother has decided na I will kick out my husband. Asawa, get out of our house kasi dito na kami, ikaw umalis kasi ikaw nang abuso. Usually, I said, hindi ganun ang nangyayari. So, ang gagawin yan, yung nanay naman, hindi naman pwedeng yung nanay umalis sa bahay. So, yung bata, pupunta na ngayon sa protective custody ng what? Social worker or any home. Okay? Now, another question would be, now, kung meron na inquest, pag may inquest, meron ng affidavit yan, may sworn statement ng bata. Umakyat na sa korte yung kaso nitong bata ito. What will happen naman? Pag nasa korte na, of course, the bata will no longer live. The child will no longer live in a place where the father is. So what happens when the child has to testify already in court? And when the child naman goes to court, all of a sudden, the child is not emotionally ready to testify. Remember, when a child goes to court, in a situation such as this, it's going to be a family court. And in a family court, the child, when going to testify, will stay in the chamber of the judge. It is not going to be in the sala where so many people, so many lawyers, so many people are watching. Hindi pwedeng ganito. This is something confidential. And other than being confidential, this is heard in the chambers of the judge. Okay. In a situation such as that, and the child is there with the PAO, public attorney is always ang kanyang magiging, tawag mo ito, yun ang magiging kanyang lawyer. And all of a sudden, the child nanginginig, ayaw magsalita. She's not ready to testify. Ano mangyayari? Anong gagawin natin? Pipilitin ba natin? We cannot force the child to testify. If the child cannot testify on that day, the lawyer will have to ask for another hearing date when the child will testify. Wait for the child to learn how to stay easy. You have to tell the child, if I were the social worker, I'm going to say, ganito mangyayari dyan. Be careful, hindi mahirap yan. Hindi ka tatakutin dyan. Wala dyan yung tatay mo. Miski magsalita ka ng ano talagang nangyari sa'yo, pwede. Judge yan. Your father is not going to be there to listen to your testimony. He's not going to be beside you. Sabihin mo sa kanya, I'm your social worker. I'm here to help you. Itong katabi natin dito, pag kino-question ka, yan yung ating lawyer, yung PAO lawyer. Kailangan ilabas mo kung anong gusto mo ilabas, kung ano talagang nangyari, para mabigyan ka ng hustisya. Okay? Okay. That's in a situation kung hindi pa ready mag-testify yung bata. Now, there can be a situation naman where the child completely refuses to testify. does not want anymore. We're not talking of not ready. We're talking of does not want to testify, but refuses to testify already. And the case is already in court. What are you going to do? What are we going to do? How are we going to save the situation? I would believe that what we have to do, especially if you're the social worker, is to talk to the child. Bakit? Hindi ba dati hindi mo gusto nangyari sa'yo? Bakit ngayon ayaw mo lang ikwento? Kasi gusto mo ng hustisya ba? O gusto mo lang kalimutan ang nangyayari? You have to tell the child anong options niya. And kung hindi na niya gusto, refuse talaga, ayaw na magsalita eh. If the child refuses to testify, o gusto mo, mag-ano muna tayo for 1 month, hindi ka mag-ano na lang tayo. Pag nasa doon na tayo sa home natin, ano tayo, maglaro na lang tayo, magpasyalan tayo. Tell her, let her mind get off the situation. Because later on, she might like already to testify. Now, what naman if the child recants her sworn statement? Recants is talagang binawi yung statement niya, yung kanyang affidavit. Kasi siguro, baka na-pressure siya ng nanay niya, na-pressure siya ng tatay niya, na-pressure siya kung sino man nag-pressure sa kanya. If you continue the case against your father, all your brothers and sisters have nothing to eat. Your mother does not know how to work, or even if she works, it is not going to be enough to provide for your siblings. So, the child says, oops, okay, sige po, ayoko na, sige po. Sabihin sa kanya nung lawyer na iba, nung lawyer ng tatay, gusto mo, ano na lang ha, bibigyan kita ng statement dito na sworn statement, sinasabi mo na, binabawi mo yung sworn statement mo at sinasabi mo, hindi naman po totoo yung nangyari. Galit lang po ako sa tatay ko noon. That recants, completely recants the statement. What will you do? And this is filed already in court. When this happens, I'm sorry to say, when a statement such as that, an affidavit such as that, is recanted, gumawa ng bagong statement na sinasabi, hindi po totoong nangyari yan. And that is the basis for a dismissal by the judge. And if the case is dismissed, that cannot be filed again against the father for that same incident na sinalbahi siya. Kasi, remember, there's such a thing, especially in criminal cases, such as double jeopardy. Hindi mo na pwedeng i-refile with same facts. Ngayon, rinicant niya yan, wala na, na-dismiss ang kaso. Ano nangyari ulit? After bumalik siya sa bahay, after 6 months, sinalbahe uli siya ng tatay, tapos nag-file na naman siya, pumunta na naman siya sa police. Diyan, yung incident yan, pwede na mag-file ulit. Pero not the situation that happened before na na-dismissan. Now, in another situation, such as, what if the child forgives? I'm not talking free cants. I'm saying, what if, in court, nagte-testify yung bata, sabi niya, ay, pinapatawad ko na po yung tatay ko. Pwede ba nung bata patawarin ng tatay niya na nando doon sa harapan ng judge, kasi nasa harapan ng judge, and with the power lawyer, and with the prosecutor? Can the child forgive? In a situation such as this, the forgiveness of a child, when the child has already testified, cannot dismiss the case. Because in a case like this, you cannot forgive. That is not a basis for acquittal or dismissal of a case. Okay? Now, this is what I'm going to talk about only because there are other conferences that you're going to attend which all lawyers will be there, such as a judge, a prosecutor, and another lawyer. So sa akin ngayon would just be the basics in a situation of a 14-year-old. Thank you, and if you have questions, just please, just write on a question and answer. Bye.
Thank you very much, Attorney Bonifacio. I'm learning a lot, no? So, hindi lang makapag-take down notes, no? Pero I'm learning a lot. Thank you very much for the presentation. To all of you, I'm supposed to comment right now. No, wala nang ligtas. Well, I always, when I delve into the field of psychology, I always have a wealth of information regarding the different perspectives because I always work with the multidisciplinary team that we have in CPU. No? Syempre, Attorney Bonifacio and Dr. Resulta is with us. Pero what's good with this webinar is that I'm also, we're also able to see how other centers are doing it because nobody knows what's the best. No? Kaya nga, best practices. What's happening right now is unprecedented unless you live in the 1900s, diba, Spanish flu. But this time around, everything is new, or we are recreating what we have been doing before. No? So I'm so honored to have introduced the speakers to you. I might not get the opportunity later, so now I'm asking you to please give a round of applause to our speakers. Maybe our speakers can turn on their video. When I call on your name, we have again Dr. Marisa Resulta. Okay. We have Miss Maria Cristina Ramos, okay, Miss Rosemary Honato, okay, and last but not the least, we have Attorney Iris Sylvia Bonifacio. Round of applause to all of them. No, thank you very much to all of you po. No, but then hold on because you have a Q&A portion later. I will turn you over to my co-moderator that I have introduced earlier on, Miss Annalyn Lindo. No, over to you, Miss Anna. Okay.
Thank you very much, Ma'am Fritzy. Yeah, okay. Magandang umaga po sa inyong lahat. Miss Fritzy, somebody from our Zoom commented na you're so beautiful daw po. You know?
I think
okay. Yeah, so, which is really, really true. Okay. Okay. Now, may I call on our panelists? Kindly turn on your video. Okay, so may I call on Attorney Irish Bonifacio, Miss Christine Ramos, and Miss Rosemary Ganato, and Dr. Resulta. Okay, so thank you so much for those who gave or participated in our question and answer portion. So we have one question here for Attorney Irish, Miss Christine Ramos, and Miss Rosemary Gonato. And the question is, what will be the necessary action to be taken by each section should the child recant her original statement regarding the sexual abuse by the father, considering she has symptoms of trauma and depression? So, Attorney Bonifacio, would you like to answer first?
When a child recants, we're talking the legal point of view. Okay. What should happen to the child is the child should be brought by a psychologist so that the psychologist can help the child. In the CPU, the Child Protection Unit of PGH, no? That we have all of these social workers, we have our doctors, we have our police, we have our lawyers. So in the situation such as that, if that person recants, the child recants, bring the child to a psychologist. We have a psychologist at the CPU, Child Protection. Bring the child to a psychologist. Now, if you're in the province, you bring the child to a psychologist there in the province who can help the child. In a situation such as that, psychologist yung kailangan eh. Kasi Other than recanting, which is from the legal point of view, ang kailangan dyan, the child has to be helped emotionally, psychologically, and that is the job of a psychologist.
Okay. Thank you very much, Attorney Bonifacio. That's really very insightful answers that you've given us this morning. How about Miss Rosemary Gunato? Do you have some input po?
In cases where the child recants in the testimony, usually they get referred to us by, the lawyer or even the social worker. So recanting is just one of the problems. There are underlying problems. So the job of the psychologist is actually to determine what are the factors that prompted the child to recant, and in what way we can deliver the services. So um, we coordinate with social workers to do, because number one that they would recant is maybe they're not feeling safe, or they are pressured by the family to, just drop the case and go on with her life. There is also the issue of forgiveness, but forgiveness and the filing of the case are two different things. So we do the evaluation, we provide therapy or counseling to this child, and we coordinate with other agencies such as the social workers, so that the child can feel safe, can feel supported, and but this would take time, and sometimes we get pressured by the lawyers or the police to you know um, para ano na yung case, ma-pursue na talaga. But, we have to do this at the face of the child. We cannot just, shortcut, because this is a process. Thank you.
Okay, thank you very much, Miss Gunato. And for Miss Christine Ramos, andyan po ba si Miss Christine
Yes.
Ramos?
Yes, opo.
Okay, so,
Okay.
opo, sorry ma'am, I cannot see you po dito sa aking screen. So anyway, what can you say about this question po? Thank you.
Very crucial ang role ng social worker para sa mga ganitong bata. In fact, this could have been prevented, yung recanting na ganito, if our psychosocial interventions ay tuloy-tuloy. There is a trauma-informed psychosocial processing. We can do psychoeducation, prepare the child in facing court or giving testimony through kids court program. Maraming pwedeng gawing interventions para sa bata to prevent recanting. I remember a case na difficult yung batang nagre-recant kasi hindi siya well supported ng family members niya. Wala siyang support eh. So, pag mga ganito, pinapa-assess talaga namin ito sa psychologist, sa psychiatrist, whether the child is suffering from accommodation syndrome, dahil maaari din itong mag-testify sa court, yung kung may evaluation na lalabas that the child is suffering from accommodation syndrome. That's why merong ganitong manifestation kasi noon yung pagre-recant ng bata. Yun po. Pero kung sustained yung helping interventions, no, comprehensive yung plan mo, bihira ang batang nagre-recant. Of course, kung sa court nag-recant na siya, it only means we didn't do our job well. Para sa akin, I'm sorry, pero para sa akin, may mga bata talagang magre-recant yan, pero kulang. Ibig ko sabihin, kulang yung preparation natin sa bata. Especially kung andun ka from the very beginning, na res geste o pagkapangyayari pa lang, nakita mo kung ano yung reaction niya, nakita mo kung ano yung sinabi niya, and during the joint interview, lahat kayo, eto yung sinabi niya. maniniwala ka kung ano yung unang sinabi niya. Kasi maraming ang factors na po pwedeng mangyari, lalo na kung matagal yung taking ng testimony ng bata. So, yun po ang para sa akin for social workers, wag tayong magkasya na natapos sa pagsasalaysay ng bata, pagpa-file ng formal complaint. Kung hindi, let us continue giving interventions para sa bata at para sa pamilya nila so that they would feel na hindi sila iniiwan sa laban na to and they are supported. Salamat po.
Okay, thank you very much, ma'am. Actually, I would love to take this opportunity because I read the participants' comment, and a certain Mr. Sherwin Lozano said, "I really love Valenzuela for Child Protection Center. I went there once to coordinate a case, and the facilities and services are great. Well done, the Valenzuela Child Protection Unit. Thank you so much, you know." Okay, so, okay, well done po. Okay, so let's move on to our second question. Now, this question, I would love to address this to Dr. Marisa Resulta. Doc, meron po tayong question. How do you balance, during pandemic, how do you balance making sure that you are safe and being able to assess and decide when to refer a child? I repeat the question. During the pandemic, how do you balance making sure that you are safe and being able to assess and decide when to refer a child? Thank you very much, Doc.
Okay, thank you for the question, Ma'am Ana. So, in the setup of child protection unit right now, before the child and the guardian comes inside the child protection unit, we assess first if the patient or the guardian has any presentation of COVID. For example, cough, colds, fever, and other symptoms. So, in CPU, in PGH, actually we have two areas to examine the child. We have what we call the clean part of the examination room, which is inside the child protection unit. And we also have an annex. So those children coming from a hotspot areas like Tondo or other crowded areas, and those children who have COVID symptoms, we see them in another area. So we conduct the interview there. Of course, as doctors, together with the social workers, we wear our own personal protective equipment and N95 masks. Aside from that, we also have acrylic face shields and also other protection in order for us to protect ourselves. And if ever the patient comes in without a mask or face shields, we provide them to the patients and also to the guardians. Now, during the interview, we will see, of course, aside, since I'm also a pediatrician, aside also from conducting a thorough medical legal examination, I also check as a pediatrician what other problems the child has. So just coming inside, makikita mo na kaagad yung affect ng bata. Is the child depressed? Is the child traumatized? So if I see that the child is traumatized and cannot divulge or disclose the incident, we will stop right then the interview and refer that to a psychologist or psychiatrist. Before the pandemic, we usually schedule non-emergent psychiatric cases, and we give them a different set of schedules. But right now, in this pandemic, the child is being seen right away by the psychologist, regardless if the child's case is emergent or not. So examining the child in terms of qualifying if the patient is COVID or non-COVID in terms of presentation of symptoms. And of course, right then, of course, makikita na namin kaagad ano yung needs ng child in terms of psychosocial support, in terms of financial support, in terms of if the child needs to be taken away from the family because the perpetrator is inside the household. So referred to a social worker and to a local DSWD.
Okay. Thank you so much, Dr. Resulta. Maraming pong salamat.
Thank you.
Thank you so much to our dear panelists, kay Attorney Irish Bonifacio. Attorney, miss na miss ka na namin sa CPU. So I hope in time we will be having some get-together once again. Thank you so much, Attorney.
Yes, yes, thank you.
Opo. Also, thank you so much to Miss Rosemary Gonato for all the valuable informations that you've given us, okay? And also to Miss Christine Ramos, okay? Ang dami pong mga lovely comments po sa inyong municipality, okay? Well done again. And again, Doc Marisa, okay? Thank you so much. Okay, so we hope that we will be able to see each other, next year sa ating Ako Para sa Bata conference. Thank you very much. It has been another fruitful day of learning, and we are deeply grateful for all the support and active participation. Thank you very much. Have a nice day. Goodbye.